Question number 1.
Nurse Mimi is providing education to group of students about Hirschsprung's disease. She doesn't require any further education if the defines the disease as A. Small, bulging pouches develop in your digestive tract. B. Inflammatory bowel disease causes your digestive tract to become swollen and irritated. C. Is a condition where your immune system attacks your own tissues when you eat gluten. D. Missing nerve cells called ganglion in the muscles of the baby's colon. Let's apply the process of elimination. Option A. Small, bulging pouches develop in your digestive tract is known as diverticulosis, which makes option A incorrect. Option B. Inflammatory bowel disease causes your digestive tract to become swollen and irritated is known as Crohn's disease, which makes option B incorrect. Option C. Is a condition where your immune system attacks your own tissues when you eat gluten is known as celiac disease, which makes option C incorrect. Option D. Missing nerve cells called ganglion in the muscles of the baby's colon, also known as a ganglionic megacolon, is the correct definition of Hirschsprung disease, which makes option D the correct answer. In a perfect condition, the bowel should alternately contract and relax to push out digestive stools. The ganglion cells are the ones responsible for relaxation of the bowel muscles. In its absence, the intestine will maintain its contracted state, narrowing down the passage. This creates an obstruction of the stool. The bowel then swells, giving the appearance of the tummy looking bloated. Here is an actual picture of an infant's intestine affected with Hirschsprung condition. In most cases, surgeons cut the section that doesn't have ganglion cells in order to bypass and avoid obstruction of the bowel. However, if the length of the section cut could no longer be bypassed, an ostomy is done to provide passage of the stools. Here are the classic symptoms of Hirschsprung's disease. Number 1. Newborn doesn't pass a dark green stool called meconium within 24 to 48 hours after birth. Number 2. Constipation that worse over time. Number 3. Passing small, watery stools as solid components are blocked by the narrowed passage. Number 4. Abdominal distension caused by stool obstruction.
Question number 2.
Aaron, who was diagnosed with Hirschsprung's disease, has a fever and watery explosive diarrhea. Which of the following would Nurse Joyce do first? A. Administer an antidiarrheal. B. Notify the physician immediately. C. Monitor the child every 30 minutes. D. Nothing, as these findings are common in Hirschsprung's disease. The correct answer is letter B, notify the physician immediately. Fever and explosive diarrhea indicate enterocolitis or inflammation of the intestine, which is a life-threatening situation. Therefore, the physician should be notified directly. Antidiarrheal is not applicable as the symptom for Hirschsprung's disease is constipation due to blockage and not diarrhea. Monitoring every 30 minutes is not enough. More monitoring every 15 minutes should be done, and these findings are not considered to be normal signs to be ignored in patients with Hirschsprung's disease.
Question number 3.
Mary and Joni brought their infant to the clinic due to vomiting and diarrhea that has lasted for 2 days. On assessment, the nurse in charge detects dry mucous membranes and lethargy. What other findings suggest a fluid volume deficit? A. A sunken fontanelle. B. Decreased pulse rate. C. Increased blood pressure. D. Low urine-specific gravity. The correct answer is letter A, sunken fontanelle. The fontanelles should feel firm and should curve inward slightly to the touch. A noticeably sunken fontanelle is a sign that the infant does not have enough fluid in their body. Decreased pulse rate is the opposite reaction for dehydration. As the body compensates to the lack of fluid, the pulse rate should increase, making option B incorrect. There should also be a decrease in blood pressure as fluid volume is directly proportional to blood pressure, making option C incorrect. Low urine-specific gravity means that the urine is less concentrated and has more than usual fluid amount. This makes option D incorrect.
Question number 4.
Which of the following electrolytes are lost as a result of vomiting? A. Bicarbonate and calcium. B. Sodium and hydrogen. C. Sodium and potassium. D. Hydrogen and potassium. The correct answer is letter D, hydrogen and potassium. In upper gastrointestinal fluid loss, hydrogen and potassium are lost because these electrolytes are present and abundant in the stomach. How many correct answers did you get? I know you got it all correctly, but wait, don't forget to hit on subscribe button and turn on notification bell so that you will be notified for upcoming videos. You can also share this to your friends. Goodbye.